So today's topic is nursing bottle caries or early childhood caries from pediatric dentistry. This is a very important essay for your final year exam and commonly asked in Viva as well. And apart from an exam point of view, this is something you'll come across very frequently in your dental practice. So it's important you're well aware about the causes, prevention and management of this condition. So let's get started. Introduction: to put in simple words, nursing bottle caries, also called as early childhood caries, is a very unique type of dental caries seen in very young children due to prolonged and improper feeding habits. So let's take a look at the unique type and feeding habits. So the first part is about the unique pattern or unique type of caries. So this condition begins as a white spot lesion in upper primary incisors along the margin of gingiva. You can see in the first picture. And as the disease continues, caries can progress, leading to complete destruction of the crown, like you can see over here. Now the second part talks about feeding habits. The use of a pacifier or bottle itself will not cause early childhood caries, but the way in which it is used, what is being fed to the child through them, and the duration of time for which it is left in the child's oral cavity is what determines ECC. And along with these factors, when there is a lack of proper oral hygiene practices, they can result in ECC as well. Headings that comes under this topic. First one is definition. So whenever definitions are asked, it's always better to write more than one definition. You can write one big definition with two small definitions. Here the most important definition is AAPD1, and to split it into three parts. So the first part talks about children 71 months, that is 5 years or younger. The disease of early childhood caries is the presence of one or more decayed, cavitated or non-cavitated, missing due to caries or filled tooth surfaces in any primary tooth in a child 71 months of age or younger, that is 5 years of age or younger. In the second part, in children younger than 3 years of age, any sign of smooth surface caries is indicative of severe early childhood caries. So you know the difference between smooth surface caries and Peyton Fisher caries. So in children younger than 3 years, if there is any sign of smooth surface caries, it is severe ECC. The third part, from ages 3 through 5, one or more cavitated, missing or filled smooth surfaces in primary maxillary anterior teeth, or a decayed, missing or filled score of more than or equal to 4 age 3, more than or equal to 5 age 4, and more than or equal to 6 age 5 will constitute severe early childhood caries. So you can just split it into three parts and easily memorize it. Now let's see the etiology. There are mainly 4 etiologic factors and few other contributing factors. Let's see one by one. The first one is pathogenic organism. So just like in adult dental caries, Streptococcus mutans is the main organism responsible, and it is transmitted to the infant's mouth through the primary caretaker, that is the mother in most cases. Other organisms include Streptococcus sobrinus, sanguis, actinomycetes and lactobacillus. Now the second factor, etiologic factor, is substrate or fermentable carbohydrates. So what is the role of carbohydrates? So the pathogen responsible, that is S mutants, will act on the carbohydrates to produce dextrans. This dextrans will result in further adhesion of pathogens on the tooth surface, where more carbohydrates are acted upon, resulting in the production of acids. This will eventually lead to the demineralization of teeth, that is formation of caries. Now let's see the main sources of fermentable carbohydrates for young children. Bovine milk, that is cow milk or milk formulas, breast milk. So most parents believe that breast milk cannot cause caries, but in fact it does. Fruit juices and other sweet liquids. Sweet syrups like vitamin preparations. There are so many sugar-free vitamin preparations in the market now. Pacifiers dipped in honey or sugar solution. Chocolates or other sweets. Now the third etiologic factor is host. So the host for the pathogens is of course, teeth. Certain features of the teeth can increase the susceptibility to early childhood caries, and this includes hypoplasia, thin enamel, and developmental grooves. Time. More the time the child sleeps with the bottle in the mouth, higher is the risk of caries. Now, this is because while the child sleeps, the salivary flow and swallowing reflex decreases. We know that saliva plays a very important role in preventing caries by neutralizing the acids. So, when the salivary flow is decreased and there is more time for the accumulation of carbohydrates in the mouth and the production of acids, it will lead to caries. And this is the reason why it is advised not to let your child sleep with a pacifier in their mouth overnight. Now, other predisposing factors apart from the main four etiologic factors: overindulgence of parents, lack of awareness of the parents, crowded homes where less attention is given to the child who has less sleep, malnutrition, iron deficiency, and low birth weight infants. So that was about the etiologic factors. Now let's see the clinical features. In the introduction, we said how the caries follows a specific unique pattern. First, maxillary central incisors are affected in the order of facial, lingual, mesial, and distal surfaces. Then the maxillary lateral incisor, followed by maxillary first molar, canine, and second molars. Mandibular molars are affected at later stage. Now, what is unique here is that the caries spreads from upper anteriors to posteriors and then to lower posteriors without the involvement of lower anteriors. This is a specific pattern that is followed in this type of caries. Now, the mandibular anteriors are unaffected. Why? There are mainly two reasons. Reason number one, because of the position of tongue that will prevent the deposition of food debris in the lower anterior region. And reason number two, because of the presence of openings of sublingual salivary gland. The saliva, like we said, helps to neutralize the acids and prevents caries formation and also helps to flush out the food debris. Thereby, mandibular anteriors are spared. Now, classification. There are three types of nursing bottle caries: type 1, type 2, and type 3. Type 1 is mild to moderate, where you can just see dull white or brown spots. Type 2 is moderate to severe. Here you can see labiolingual carious lesions affecting the maxillary incisors with or without the molars. Type 3 is a severe case where caries lesion involves almost all the teeth. There is complete destruction of crown structure and it is seen in 3 to 5 years of age. The next heading is stages of early childhood caries. There are 4 stages of early childhood caries. In stage 1 or initial reversible stage, just look at the picture, you can see chalky white demineralization. Cervically and occasionally in the interproximal areas, you can see chalky white areas of demineralization and there is no pain reported. Stage 2, the second picture, damaged carious stage. Here there will be yellowish brown discoloration and the caries has spread into the dentin and there is pain on having cold food items. Now stage 3 is the deep lesion stage. It occurs at a later stage, that is 24 to 36 months, but depending on the time of eruption of the teeth, the karyogenicity of the sweetener and frequency of use, it may also be present in 10 to 14 months. Here the molars are also affected. There is frequent complaint of pain because of involvement of pulp. So pulpal involvement is there in the maxillary incise. Stage 4 or the traumatic stage, just look at the picture, how you can see how the maxillary anteriors are completely destroyed. It occurs in 36 to 48 months. The teeth has become so weakened by caries that a very small force is enough to fracture them. Parents may report history of trauma. The molars are now associated with pulpal problems and maxillary incisors have become non-vital. So that was about the stages. Now let's see the management. Let's just briefly go through the management of this condition. The most important thing is parent education. So educate the parents about improper feeding habits, oral hygiene measures. Ask them for the cessation of improper feeding habits. give them oral hygiene instructions, including fluoride toothpaste, or even the use of fluoride tablets in areas without fluoridated water. Diet counseling, give them a diet chart, ask them to write down what all they give their child. And as a preventive measure, you can give topical fluoride therapy, pit and fissure sealants for when there is newly erupted permanent molars. And for the existing caries lesion, restoration of the caries, pulp therapy wherever there is pulpal involvement, and extraction of non-restorable teeth, because it is not wise to leave root stems in a young child's mouth because these are foci of infection, and it is always advised not to lead sources of infection in a child's mouth. So these non-restorable teeth can be extracted, but they should be followed by space maintainers, and if there is any abscesses present, they should be drained. That was all about nursing bottle caries. Another question that is usually asked along with this is the difference between nursing bottle caries and rampant caries. Nursing bottle caries is in fact a specific type of rampant caries. So let's quickly go through the differences between them. So rampant caries is acute widespread caries with early pulpal involvement of teeth which are usually immune to decay. Now, age of occurrence, nursing bottle caries occurs in infants and toddlers, while rampant caries can be seen at any age including adolescents. Nursing bottle caries affects primary dentition, while rampant caries can affect both primary and permanent dentition and also mandibular incisors as well. In nursing caries, there is always a specific pattern that is followed, which we discussed in the previous slides. The mandibular incisors are not involved, but in rampant caries, there is just rapid appearance of new lesions and not just years of chronic decay due to neglect. Etiology, we discussed nursing bottle caries is mainly because of improper feeding habits like bottle feeding just before sleep, pacifiers dipped in honey, or prolonged atrial breastfeeding. In case of rampant caries, it is multifactorial, like not just feeding practices, frequent snacking, excessive sticky refined carbohydrates, decreased salivary flow, and even genetic background. Coming to the treatment, in case of nursing caries, when they are detected in early stages, they can be managed by topical fluoride application and education of the parents. And the main focus is towards the maintenance of teeth until the permanent teeth erupts. While in rampant caries, there is a requirement for pulp therapy because there are multiple pulp exposure, and long-term treatment may be required when the permanent dentition is also involved. So that was all about nursing bottle caries. I hope you guys found this video helpful. If yes, please forward to your friends, and also don't forget to subscribe to our channel and also tap on the bell icon so that you don't miss any new videos. Thank you.